can track across competition, in this case a swimming race. And we get our pre and post warm-up measures, and actually there's not been an awful lot of change there. So again, similar to what we saw a couple of slides ago with the training, we didn't get an awful lot of change in the muscle as a result of a training session, and similarly the warm-up hasn't made a huge change in the muscle. You know, this isn't fresh out of bed, this is actually in the middle of a competition. Post-race, we've got this massive reduction in displacement, a tightening of the muscle. Clearly the high intensity activity that's gone on there, the fast racing, has resulted in this fatigue, this stiffening of the muscle. And then we get our post-warm down measure. We can see that we've returned somewhat towards our baseline measure, but not the whole way. So it begs the question, has the warm down not been effective? Has it not done its job? Do we not want that muscle getting right back up to here? Not necessarily. He's not racing again straight after this warm down. He's going to go away and recover. So actually that might just be the catalyst that starts the recovery, and then after the time that he takes away from the pool in the hotel before returning for the final in the evening, that might be sufficient. Or it might be that the warm down's not been effective enough. It might be that the warm down has been effective because actually this whole range is acceptable for a muscle. And again, we're getting away from this individual point. So what we can start to build up is an idea of a slightly larger range for each muscle, a range that we expect the muscle to be able to function properly in order to aid performance. And we can see that some muscles have far narrower ranges than others. Generally, the muscles that have higher displacement are going to have a wider range. We can also see here, I've picked these two on purpose, we've got one who's more or less fairly symmetrical, although the ranges are slightly different. The means there are about the same, and one that's a bit more asymmetrical. But we've got these ranges, we want our individuals to fall within, and every measurement we do can contribute towards what you see here. We can fine-tune these ranges and hone them down, because every normal measurement we get, every measurement where the function is fine and the performance is acceptable, can be built into this model to fine-tune and make those ranges more accurate. So we can track different muscles, of course, and not every muscle responds exactly the same way to exactly the same load. So here we have our same time points of our race, our pre-warm-up, post-warm-up, post-race is here, and then our post-warm-down. And we can see we've got the vastus lateralis and the gastrocnemius medialis at the top and the bottom respond more or less the same way. We get this dip post-race in both cases. Bicep femoris, we don't get that same response. We get a very different shape to the response across the time of the event. It makes sense when you think about it. The different skills that are being performed are not going to make the same demand on every muscle in the same way. So actually treating every muscle group, every area and compartment of the body in the same way when you warm up is going to be completely inadequate. The warm-up strategy has to reflect the fact that muscles are going to respond differently to the same exercise because the muscles aren't contributing exactly the same thing to that exercise. And further than that, we can actually see the same muscle on different sides of the body. So we've got the right side in orange and the left side in blue. Don't even respond the same. So this is across a whole weekend of racing. And generally, the dips that you see here are post-race. And we can see here in particular, we've got the right side seems to have fatigued a great deal and the left side not so much. So why would that be? If we go back to our kind of profile, we can see that the left side here has a bigger range than the right side. So why would one side have greater variability, a wider range than the other side? Is this muscle impaired in some way? Is it inferior? Is it not as strong? Is it having to work much, much harder each time just to keep up with what its twin on the right-hand side is doing, and therefore the stress that it's put through during the task is much greater? That could well be the case. If we were to balance the strength of these muscles on each side, would they respond in a more similar fashion during the race? Or actually, is it the technique that's the issue? Is it a technique that's involved in this race that's very, very dominant and uses the right-hand side to a much greater extent than the left-hand side? And so there's a number of different questions to be answered here, and again, it all comes down to context and looking at the individual and how they respond. My first inclination when I saw this was, what side did you breathe to? Freestyle swimmer. Breathe to both sides, right? That doesn't help. So we start to ask these questions, we start to try and piece together our jigsaw and work out why we're getting these different responses until we hopefully narrow down, probably won't be one reason, but the multiple reasons why we're getting these. So in terms of asymmetry, these are some early data, so they're not quite up to date, but from our elite swimmers up in Scotland. And you can see that these are high performing athletes, but there's high levels of asymmetry. So this is actually flipped around from what Sergey was showing you earlier, in that this is asymmetry rather than symmetry we're assessing, so a higher value is worse. So what we're looking for is 0% being perfectly symmetrical, perfectly the same. Now, some work that I did in the lab showed that individuals who are asymmetric based on force, so this was a isometric knee extension NVC, were more likely to have at least one muscle within that muscle group that was asymmetric. And in this case, the rectus femoris is where we have a significant difference. That probably is coincidental. It could be any muscle. And actually, if we start to look here, although there's no statistical significance, you know, from a qualitative point of view, we could probably say that symmetry is looking slightly more likely in all three of these muscles in this case. So can we do anything about that? Well, here's a little case study we did. One athlete, high levels of asymmetry. We were just really interested in lower body at this stage. So we assessed that asymmetry, and then I really passed it on to the S&C coach. My job was done to an extent. They put together a program that was designed to try and reduce asymmetry. I'm avoiding saying the word improve symmetry. They were trying to reduce asymmetry. 6 months later, we measured again. Looks like a decent improvement. 4 months later, we measured again, and well, we've kind of plateaued a little bit with a couple of muscles. We've shown a further improvement on the hamstring there. We completed the 12 months with a further study, a further measure 2 months later, and we can see from start to finish a marked reduction in asymmetry across all three of those muscles. So I know what you're thinking. The big question is, well, does that affect performance? And I have no idea, to be perfectly honest. All right, it could do, it could not. We can't really confirm that there's a direct correlation between reducing this asymmetry and making someone perform better. But what we can do is try to reduce our asymmetry and then look at other markers that potentially could contribute to our performance. So we can look at reduced asymmetry. Does it make them stronger? Reduced asymmetry, does it make them faster? Does it make their skill performance better? And all of these can then be pieced together to, okay, those all contribute to performance, so therefore surely reducing asymmetry will lead to an increase in performance. The other thing we can do is compare different individuals. So here we have two hockey players, both forwards, both very similar style of player, very similar in a number of ways. We've got one who's quite highly asymmetric, hopefully you can see from the figure there, and one who actually has quite good symmetry across the board. Is one athlete more susceptible to injury than the other? Does one athlete suffer from fatigue more readily than the other? Does one athlete perform better on metrics of power, speed, strength than the other? These are the kind of questions more longitudinally that we can start to answer without having to actually intervene to try and change this athlete's symmetry. We can compare similar athletes who show different kinds of muscle profiles. Now, all of that being said, there's a bit of an elephant in the room here, and it would be remiss of me not to draw attention to this paper that came out just a couple of days ago. And they claim that TMG is not sensitive for monitoring muscle fatigue in elite youth athletes. I've just spent half an hour or so telling you about how we use it to assess fatigue and symmetry and all kinds in elite athletes. What they did here was use counter movement jump as their marker of fatigue, and they used the TMG measurements. They used velocity that I described at the start, they used displacement, and they showed that although there was a decrease in counter movement jump, there was no change in the TMG parameters. So they dismissed TMG as being sensitive enough to track fatigue. But how many components are there to a counter movement jump? How many muscles, how many joints are used? How much central contribution is there to the performance of a counter movement jump? So because there was no sign of fatigue in the periphery of individual muscles as assessed by TMG, there may have been fatigue elsewhere, and that was what the counter movement jump was picking up. So I guess the point is that there's a limitation, and we should be aware of that. But that limitation doesn't have to be limiting. It can be a strength. The TMG can tell us what a counter-movement jump can't, because it can tell us about the individual muscle at the periphery in isolation. Counter-movement jump can just tell us about the whole body, how fatigued is it. We can locate specific areas of fatigue using the TMG.